Air travel. Now, why would someone caution about air travel? And there's a couple things. One, generally we don't recommend air travel, and the airlines recommend or restrict travel to under 36 weeks pregnant. So less than 36 weeks pregnant. Why? Well, they don't want people laboring all the time on their planes, and so that would require often an emergent situation, diversion, things like that. So 36 weeks generally is the cutoff for any air travel at that time. However, if somebody potentially has a more complicated pregnancy, whether that's blood pressure issues, or they have a history of preterm labors, for example, if they deliver at 36, 37 weeks in their prior pregnancy, I would bump that time frame forward by potentially a few weeks. Depends on the issue, but again, that's where you're gonna have to talk to with your doctor, your provider, about the best travel plans for you. Also, another thing to consider is that pregnancy slightly makes somebody a little increased chance of developing blood clots. These are blood clots that usually start in the legs, can potentially go up to the heart and lungs and cause bigger issues. And so if somebody has an extended air travel day or an extended car travel, generally every hour or two, we might recommend getting up, walking around, helping keeping that blood moving, and that'll help decrease your risk. You can also do the foot pumps to help keep those calves pumping, keep the blood from pooling in the lower legs, because likely someone will get swelling, and potentially that blood will become more static within the veins of the lower legs. Another thing, right off that point, you might want to consider something like stockings to help reduce that swelling and potentially that pooling of the blood in the lower legs also.